From the JAMA Network, this is the JAMA Pediatrics Editor's Summary, a discussion of the most important articles published in the latest issue of JAMA Pediatrics.
Hello again, podcast listeners. This is Dimitri Christakis, Editor-in-Chief of JAMA Pediatrics. With me, as always, my close friend, colleague, Associate Editor, Alison Galbraith, joining us from Boston, where she lives and works. Hi, Allie. How are you?
Hi, I'm good. Good to be here.
Good to have you this August day, where it is nice and sunny in Seattle. We have two interesting papers. They're quite different. As usual, I'll have you go first, Allie. Let's hear what you have to talk about.
Yeah, so this paper is called Community Health Worker Home Visiting Birth Outcomes, Maternal Care, and Disparities Among Birthing Individuals with Medicaid Insurance. It's from a group of investigators from Michigan State. And they're looking at home visiting programs. And these have been around for a while. They've been looked to as a way to address perinatal health disparities. There's been some mixed results about the impact of programs like this on birth outcomes. And it's also been a challenge in these programs to reach Black and Hispanic Medicaid insured pregnant people. And so the thought with this particular type of program is that using community health workers who are from the community, culturally concordant, racially, ethnically, language concordant, if you have community health workers working with nurses and social workers, is that a way to reach high-risk individuals and address inequities?
Good.
So this study is evaluating a program called Strong Beginnings that was used in Michigan. And it mainly serves Black and Hispanic families. And again, it's racially, ethnically, and language concordant. The community health workers are. So they have shared community, cultural knowledge, and the idea is to build trusting relationships. And they partner with nurses and social workers. And they provide peer support, goal setting, empowerment, and try to reduce barriers and make referrals. So the program operated in one county in Michigan within a large metropolitan area. And they wanted to see evaluate the association between participating in this home visiting program on the association with adverse birth outcomes and perinatal care for birthing people in Medicaid compared to usual care. So the usual care control group were a propensity match group of other dyads who had a Medicaid birth in other Michigan counties at the same time, which was from 2016 to 2019.
It was not a randomized experiment, just so our listeners know.
No.
They tried to propensity match, which we've talked about before.
Correct. Yeah. So they're trying to make comparable the two groups, but it's not perfectly randomized who had access to this intervention, right? And so it was a retrospective study too. So they were able to look back and used Medicaid claims data as well as birth records to get some of the variables that they used. Their primary outcome, they had several outcomes: preterm birth, very preterm birth below 32 weeks, low birth weight, very low birth weight under 1,500 grams, and then adequate prenatal care and postnatal care receipt at 3 weeks and 60 days for the birthing parent. And so they had over 125,000 dyads. So of those, about a little over 1,000 were in the Strong Beginnings community health worker program. And they found that being in the program was associated with a decreased risk of preterm birth, 2.2 percentage points less, decreased percentage with very preterm birth, a decrease of 1.2 percentage points. Low birth weight was also decreased by a little bit. And there was a greater percent with adequate prenatal care and postpartum care within 3 weeks, which was 21 percentage points higher. And within 60 days, that was 24 percentage points higher. They also found that these risk reductions in adverse birth outcomes were greater among Black individuals. So that was also really exciting. So their conclusion is that these community health worker home visiting models are promising, associated with reduced risk of adverse birth outcomes and improved prenatal and postpartum care for birthing people versus usual prenatal care, and that the positive effect looks significantly larger for Black individuals. So that's encouraging.
So tell me, Ellie, a couple thoughts on this. It's great to see something work. The effect size is not enormous, right?
Correct.
It's a 1.2% reduction, which when you're talking about preterm birth, it's
not a big number to start with, right? It's probably a pretty good size relative reduction, but that's not what they present. But yes.
That's a good point. So that's the absolute risk reduction, not the relative risk.
Correct. And those numbers are low, right? Very preterm births, especially. I don't have that right in front of me, but that's not a big number.
Right. So then the magnitude of the effect actually might be large. So that's good.
Mm-hmm. Yeah.
And I guess the other thing that jumps out at me anyway is, this is a good example of how we need to pursue greater equity in the testing and dissemination of our models? Because, if we test things on one population and find benefits, and that population is not representative or very underrepresented of a certain subgroup, then we can't necessarily apply it to them and may need to come up with more tailored approaches like they did here.
Yeah, I mean, that was the whole idea that these are, because there are other home visiting programs, but these community health workers were, people from the community. They have similar lived experience as the pregnant people that they're working with. And so, the idea being that they can have a greater impact or greater engagement with people in that way. And, it's hard to know what mechanistically is that what actually happened. We can see that it did have a stronger impact for the Black patients in the study, but what part of it was doing that, we don't really know.
Yeah, I hear you. Interesting. And then the question that always remains with these things is who's going to pay for it? Because even the Nurse Family Partnership, which has a long history of showing benefits, still reaches a very small percentage of eligible families that would benefit from it.
Right. The nice thing is that, community health worker interventions are probably less expensive than, having someone with an RN degree going out to the home and doing that stuff. So it might be a more efficient use of dollars.
Absolutely. And of course, this could be paired with other service delivery that they might do in the home at the same time.
Yeah.
Great. Okay.
Yeah.
Good to hear something that actually works for all patients.
Yes.
All right. The next one is not as encouraging. This is the association between the COVID pandemic and early childhood development. It's from Japan, and it's an observational study that is kind of a little bit of a natural experiment. And the question here fundamentally is, of course, what was the impact of shutdowns on young children's developmental outcomes? We've actually published a couple of papers on this. One of the challenges, of course, is that this pandemic happened without anybody being necessarily positioned to have the data to address this robustly. But this group was already in the field doing longitudinal assessments of children in daycares in one municipality of Japan. And they took advantage of the fact that they had data on kids when they were 1 and 3 years old, and they were followed until the age of 5. And they collected data between 2017 and 2019. So if you think about the 2-year follow-up for the 2017 and 2018 is going to be pre-pandemic. And in the 2019, those kids at 2-year follow-up are going to be during the pandemic. And the age of the kids vary. They're between 1 and 3. So they're now looking at the data in 2 cohorts, kids that were 1 to 3 pre-pandemic versus kids that were 1 to 3 during pandemic, and kids that were 3 to 5 pre-pandemic compared to kids that were 3 to 5 during the pandemic. And of course, the pandemic brought disruptions in children's daycare experiences. Actually, though, it's not as huge as I thought. It's interesting. They say that they missed on average 1.9 days per week of nursery attendance during the emergency periods. And this I thought was interesting.
Yeah, that was surprising.
It wasn't that large.
That must be averaged over. Like there must have been times when there were weeks with nothing, and then
I think that's exactly what it is. It's exactly what it is. But the interesting thing is, outside of the pandemic, the average attending was 5.1 days per week, which I also thought was interesting.
They must go on Saturdays.
They must go on Saturdays, at least some of them, or Sundays or something, which is a lot, certainly by U.S. standards. And they did comprehensive developmental assessments of these kids, looking at physical motor manipulation, receptive language, expressive language, language concepts, social relationships with children, social relationships with adults in both cohorts at both time points, and did a comparison. I think the results are really interesting. And then I think it's interesting to think about why they found what they found. So in the kids that were 1 to 3 pre-pandemic and during the pandemic, they didn't see actually detriments in development. In fact, interestingly, in some domains, they actually saw that they were doing better.
Yeah.
The overall effect was no difference. But if you look at some of the subdomains, particularly in manipulation, in language concepts, in social relationships with children, and with social relationships with adults, they were doing significantly better during the pandemic than after. But the results for the 3 to 5-year-olds, unfortunately, were the opposite. and they showed an overall deficit. And then they showed significant deficits in virtually all of the subdomains. So I guess one interpretation of this is that younger children during the pandemic, 1 to 3 years of age, didn't suffer developmental harm and may have even seen some modest benefit. And older children saw a significant detriment. In fact, on average, they were about 4.5, 5 months behind where they otherwise would have been.
They also said that there was greater variation
Yes.
in development, that it widened basically in the pandemic, which that's concerning, right? Because it means I'm imagining if you have really attentive parents or really good resources, you're able to, your kid does okay, but other people might not do so well.
No, I think that's exactly right. And I think that probably does explain a lot of variance, that daycare centers, particularly if they're high quality and deliver sort of more homogeneous approaches, tend to try to shrink. I mean, if your kid is in daycare 6 days a week for 5 or 8 hours a day, right, that's a kind of an equalizer because,
oh, right, fair, yeah.
A lot of the time that they're awake, they're all in the same environment. But my explanation for this, my hypothesis for why they saw these differences is that, the younger children during the pandemic, 1 to 3, let's say, had to, by definition, get a lot more one-on-one parental attention, which for that stage of development is key. I don't think there's anything better, frankly, than particularly for very young children, than one-on-one time with a loving caregiver. But for the older children, being around other children and learning from other children, playing with other children, interacting is essential for their development. I also think, as an aside, 3 to 5-year-old children in home environments can be entertained by screen media. So if you're a parent working from home and you have a 1-year-old or 1.5-year-old, by hook or by crook, you're going to be stuck keeping that kid on your lap, getting on the floor with them. But if you have a 3 to 5-year-old, you can park them in front of a television or an iPad and go about your work. And that may very well explain the differences.
Yeah. You know what else I thought was really interesting? And this also goes back to the point about, in general, it's better if your kid is home and there's a loving caregiver giving them attention. But they found that parental depression amplified that association between the pandemic and delayed development for age 5. And so that was really concerning too.
Excellent point. And, other studies have found just that children of depressed parents have detriments. And you're right. And of course, the pandemic, they didn't study this, but probably was at least partially responsible for increased maternal depression during it. So, yeah, the truth is that what we're learning is that the pandemic affected different subgroups by age, different subgroups by race, ethnicity differently, and that those effects are lingering. I mean, we're not done with them. A 4 or 5 month detriment in 5-year-old children is overcomable, but it's going to take effort. You don't just go back to the usual care, as we say, and expect everything to normalize for that cohort of children. All right. Well, I want to thank you guys again for spending some time with us. I also want to alert you, spoiler alert, that we will be changing the format of this podcast going forward in a way that I think will be very exciting. We will be discussing topics with leading experts in the field, people and or maybe you don't know, but you should know. And we will be picking their brains about both the topic at hand and their own professional development and professional learnings. So we look forward to having you join us for those. Those will kick off next month.
This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.